Hi, everybody. Welcome. Thank you so much for joining us tonight. It has been a very busy and eventful day. I'm Angela Rasmussen. I am a member of the Save America Movement Public Health and Science representative on the steering committee. I am here joined today by my colleague, Jessica Malaty Rivera, a wonderful epidemiologist and science communicator. And together we are going to break down the very, very eventful day of Robert F. Kennedy Jr.'s testimony to the House Ways and Means Committee in the morning, as well as in the afternoon. Then he headed over to the Appropriations Subcommittee that oversees the Department of Health and Human Services to talk about the White House's budget request, which would like to cut about $12 billion from the HHS budget. So he had a lot of interesting questions to offer, and there is quite a lot of material to unpack. So I don't know, Jessica, I mean, you watched some of these proceedings today. For those of you who've been following the Secretary of Health and Human Services, you know that it's at least never a dull moment most of the time when he goes to speak with his colleagues from the legislative branch. And today was once again a very lively discussion between him and those Congress people. So I'd just like to hear from Jess to start off with. What was your favorite moment?
Oh God, my favorite moment? Maybe when he got into a spat where he couldn't answer the question of if he had instructed the CDC to change or, in fact, remove their flu vaccine messaging. They were referring specifically to the campaign that was taking flu from wild to mild, a recommendation to the public to get your flu vaccine for the purpose of harm reduction, of reducing the severity of illness, hospitalization, and the risk of death. And instead, he kept spouting incorrect statistics about the measles epidemic that is happening both in the US and in Mexico, comparing us to Canada as well as other countries, and saying we're somehow doing a better job than everybody else because that's how you answer a question about flu campaigns, apparently, Angie.
This was one of the most interesting questions, I thought, because, as much of a fantastic job that we're doing with measles, which Kennedy had a lot of interesting things to say about measles. So I think we should dig into this a little bit more. But as much as he thinks he's doing a great job with that, he thinks that the US did a terrible job with COVID because he said over and over again, and every time this came up, I just wanted to scream. It happened in both hearings. He said that basically the US had more COVID deaths than any other country in the world, which is not true. We did have more COVID deaths than many other countries because our response was certainly not great, but we did not have the most deaths in the world. The US did not even really come close to those kind of numbers because the US does actually have a healthcare system. And so the numbers that you would be thinking about there belong to a country that probably hasn't even reported all the deaths, the higher percentage of deaths in their population, because they are not a wealthy country that probably doesn't have a healthcare system. So, that's what Kennedy thinks the US did. We failed at COVID so badly that everybody died. But at the same time, we actually killed everybody with lockdowns and school closures. We didn't actually really kill people with COVID. It was because we were trying to keep people from getting COVID. They didn't get COVID, but they all died from the lockdowns. So as great as measles is, when everybody seems to be getting it, and I guess we don't have as many cases as Mexico did last year, but we're closing the gap. We are doing a great job there. But COVID, we did a terrible job. 10 times the deaths of Europe. He said that twice too. These are all totally made up things. And I mean,
Yeah.
that's really what I think Jessica observed. I think that's what we all probably observed today was, which thing is Kennedy going to lie about in response to this question? Or which question is he not going to answer? Or which question is he going to answer with another question that's about something completely unrelated to this?
Yeah, yeah. One of Kennedy's favorite talking points, it's a very common anti-vaccine talking point that he said twice today as well in the Ways and Means Committee hearing, was the false claim that the hepatitis B vaccine only had 4 to 5 days in the trial. It is such an easy thing to debunk. because it is such a incomplete reading of what the actual vaccine insert says in the vaccine packaging. It is derived from a very incomplete interpretation of follow-up appointments, follow-up observation that happened in the initial safety trial of the hepatitis B vaccine. But it's a brainworm, for lack of better terms, that cannot get unstuck out of people's minds, including RFK Jr., who has to know that this is untrue, but continues to do so while lying under oath about it.
Well, see, that's the thing. I know that Kennedy knows that what he's saying is not true. I mean, apart from the fact that he's been saying this stuff for the past 30 years, he's written multiple books on it. And he's, had these debates with these legendary vaccinologists like Paul Offit and Peter Hotez and Stanley Plotkin. These are all, for everybody watching, those people are all legends of vaccinology. And they've all taken the time to try to explain this to him. He's literally had the world's greatest living vaccine experts explain this stuff to him. And he knows that it's wrong because today he was also asked if the measles vaccine is safe or effective. And the congressperson who asked him really pinned him to the wall, would not let him answer it with anything but yes or no. And so he said, yes, of course, because that is the truth. And you really can't weasel your way out of that one when it's a yes or no question. He said that the vaccine was safe or effective and people should get it, or most people, it's safe and effective for most people.
Yeah.
That's what he snuck in there.
Yeah.
And that's what he does every single time. He will say the stuff that he's supposed to say. And right now, as we've discussed before, he's kind of like on probation. He's not really in trouble, but if he goes like too anti-vax crazy and like screws up the midterms for the Republicans, then, he's not going to be the Health and Human Services Secretary any longer. And he's going to have to go back to making propaganda with Children's Health Defense and suing vaccine manufacturers like he used to do. He doesn't want to do that. So he wants to keep his job. So, of course, he's going to say things like, yes, the measles vaccine is safe and effective because no, I'm definitely not responsible for these catastrophically huge historic measles outbreaks that we're currently having. And that, in fact, I've not done a very good job at all in controlling.
I just don't think he can help himself, Angie. It's just so part of his nature and these talking points are so recycled and regurgitated that he just can't help saying these things that we know are false. Even if there is documentation of the hepatitis B trial lasting 9 to 18 months for follow-up for adverse events, he can't help but say it was only 4 or 5 days because that is a battle cry for the MAHA movement before the MAHA movement became branded as MAHA. That has been a talking point that has persisted in the anti-vaccine movement. So even though he's not going to say I'm anti-vaccine, he's still pumping the American public through these public hearings in these very consequential meetings with these ideas that I think is really sinister. I think what he's trying to do is to still have the people who maybe heard a clip, maybe tuned in for a couple seconds on YouTube or C-SPAN and said, well, why would he say it was only lasting for 4 or 5 days? It's all part of this deep desire to undermine credibility and confidence in vaccine safety protocols, in vaccine trial science. It's why they are using all this very grandiose language of gold standard, rigorously tested, evidence-based, blah, 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 where they're saying nobody's ever done this before because everything beforehand was, I think he used the word lackadaisical, haphazard, irresponsible, etc. And now they're coming in to actually do the work. He had some quite offensive things to say even about the dietary nutrition guidance of in the United States prior to the completely nonsensical version that exists now, not to mention the fact that it's not a pyramid, it's just an upside down triangle. And the years and years of research that went into the previous guidance, which was as long as the new one. And he keeps talking about it being 400 documents. The new one is no different. They've just switched it around and removed the equity lens that they complained about in the previous edition.
Well, speaking of the equity lens, that was basically all the Republicans in both committees had to say today.
Yes.
Was they were just very happy with Kennedy's views on everything. One woman, Tenney, I believe, Congressperson Tenney, loves Novak Djokovic and was so happy that Kennedy tried to intervene to get him issued a visa when he refused to get a COVID vaccine and wanted to still come compete in the US Open when he had COVID, if I
Yeah.
recall. I mean, the whole thing was ridiculous. And it was like Kennedy then played tennis with Novak Djokovic because, I guess anti-vaxxers, like celebrity anti-vaxxers, stick together. He's playing tennis with Djokovic. He's going dinosaur bone hunting with Jeffrey Epstein. He gets around and does a lot of things with a lot of notable people, all in the anti-vax world or the pseudoscience world or the just general predatory asshole world. And that's who Kennedy is. That's who he hangs around with. So it's hardly surprising to me that when he's talking about serious issues of people's lives, people's children's lives, he's going to make up stuff because his position is actually indefensible. And I was really proud to see that several of the Democrats, anyways, really did raise this at this point as a moral issue. And that's what we need to start discussing this as, because people talk about this like, oh, we're working on the budget for next year. We have the appropriations budget hearing. I mean, it sounds very boring and it's not something that probably most people concern themselves with a lot. But, this is a matter of life and death. It's not a matter of, I don't like this policy or I think my tax dollars should be spent differently. This is truly a matter of this man who is in charge of our health thinks that it's okay and acceptable to kill people and mostly children, again, to satisfy his own, like the weird studies that he does. I mean, I don't know if you saw the news yesterday. Boy, we'll have to show a little clip of this too. We don't have one queued up for you today, but apparently there's been another roadkill incident that's come out of Robert F. Kennedy Jr.'s history. Yet another family vacation in the old minivan for the Kennedy clan resulted in Dad pulling the minivan over, getting out, and performing a sort of impromptu necropsy on a road-killed raccoon and removing its penis for later study. As somebody who professionally has performed necropsies on animals and, in fact, also has removed their penises for scientific reasons, I truly cannot imagine why you would need to save something like that from a rotting road-killed raccoon for a later study. But that, I think, just goes to show you the level of scientific competence that we're dealing with here in terms of our Secretary of Health and Human Services.
Yeah. Yeah. I mean, it's the defensiveness too that came from even some of his questioning was pretty remarkable. I mean, I know we are going to show a clip pretty shortly about an exchange that happened that was really charged and really, really honestly hard to watch. And I think it was Van Dyne or who was it that shortly after was basically, or somebody, maybe it was somebody else, basically antagonizing the entire questioning, saying how absurd it was to even be asking the type of question of what kind of child, what race of children has he parented before, completely missing the point of what he had said in the past and his, once again, like very selective memory when it comes to recalling what he has said in the public domain on public podcasts. We've got the receipts, and so maybe we should cue that up now, Angie, and have people listen into what happened today and then the historical.
Yeah, let's play clip number one, and it just goes to show you it's not a long trip from weird to racist eugenicist.
Yes.
If we could play clip number one when you get a chance.
You've made a number of outlandish and frankly disturbing comments both before and during your tenure as Secretary of Health and Human Services. I want to draw your attention to one of those times. In a 2024 podcast interview, you suggested that Black children on ADHD medication should be reparented. You said every Black kid is now just standardly put on Adderall, SSRI, benzos, which are known to induce violence, and that those children are going to have to go somewhere to get reparented. There is a lot to unpack in that comment. I know that you've already answered several of the questions I was going to ask, and so I'm just going to rephrase them. Mr. Secretary, you've already admitted that you are not board certified physician, and you've already admitted that you did not go to medical school. Have you ever reparented, or parented, I should say, a Black child?
I don't even know what that phrase means, and I doubt
just
that
a yes
I
or
said
no
it.
answer.
I doubt that I said that phrase.
You
No,
absolutely
I'm not
said
going to answer something that I didn't say.
You absolutely said it.
Oh, I'd like to hear the recording.
So to be
Because
clear,
it doesn't make
sir,
any
I'm
sense.
I'm
I
gonna
don't even know what
reclaim
it
my time.
means.
I don't either. That's why I'm asking.
And by the way,
So to be
of
clear, you're not a
26
doctor, you have no medical degree, and you have no formal medical training.
as
And
have,
you have never
as have,
parented a
as
Black
have
child. And yet you are
24 of the
suggesting
26
that
HHS
government-
secretaries
Mr.
have not
Secretary,
had medical
This is my
degrees.
time. And I say to the chairman, I want to reclaim my time. So you are not a doctor, have no formal medical training, and you've never parented a Black child, and yet you are suggesting that the federal government should take Black children away from their families and reparent them and send them off to some wellness farm instead of providing them with evidence-based.
You're just
medical
making
care.
stuff up.
I am absolutely not making this up. Mr. Secretary, in your opinion, what factors should the federal government consider when reparenting a Black child who has been on ADHD or ADD?
I don't even know what you're talking about, Congressman. I don't know what you're talking about. I don't know what reparenting even means.
I don't either, but you said that.
Just really remarkable, you know? I mean, to actually say something like that, first of all, reparenting, and we're going to play for you in just a moment what he actually said. We do have the tape. But even to suggest that your child is diagnosed with a medical condition. And by the way, if we're talking about ADHD, I mean, I realize I'm not a minor and haven't been one for a long time, but I have it too. So what am I supposed to do? Get removed from society and sent to like a wellness farm because I have a neurodivergent condition? It's very strange. It's a very sinister attitude to say that children of a certain race, which he dealt with that several times today, saying that he basically doesn't see color. He sees a community that has different health needs because of, I don't know what it is actually, he says. But, you know, he didn't say reparenting either, except he did. Tara, do you think we could play clip number 2, please?
Psychiatric drugs, which every Black kid is now just standard put on Adderall, SSRIs, benzos, which are known to induce violence. And those kids are going to have a chance to go somewhere and get reparented.
Directly from his mouth. On a podcast in 2024, the podcast, I believe, was called 19 Keys High Level Conversations Podcast. It's unbelievable to me how he says these things with such confidence and then misremembers them or completely forgets them with such confidence, with such absolute certainty that there's no way he could have said it. He'd have to hear a recording. This is very specific language, Angie. It's not like he may have said something to the effect of like the incidence of those types of prescriptions. He has fully believed this because he has fully been on a tirade against SSRIs, against ADHD medication, because he does believe, race or not included, that these things are actually causing so many of the problems that he thinks he's going to be solving through his MAHA agenda. But to add the race factor to it is just as impossibly, you cannot understate how sinister this is. We've often said, without being hyperbolic, that many of the policies that underwrite this movement have racist and eugenic backbones. They ascribe to a anti-germ theory philosophy, a terrain theory ideology that believes that if you're just the fittest, if you're just better bodied, more able bodied, or more wealthy, where your environment is cleaner, less harmful to you, you have better food, etc., you're gonna just survive better. It goes way, way back. And so this idea where he says the word all Black children, and then even uses the word reparenting, which he somehow forgets that what that word even means, tells you probably what's happening behind the scenes about these types of conversations. This is lexicon that they use regularly, that he would repeat it on a podcast.
Yeah, and I mean, they repeat it because when they repeat it and they don't actually describe what they actually mean, they're able to use euphemisms, and that normalizes it for a lot of people. They're like, well, it's a wellness farm. It sounds fine. It sounds a lot better than we're going to take all Black children, especially if they're taking any kind of medication, because last I checked, SSRIs are not a treatment for ADHD.
Nope.
They are a treatment for depression. Literally, it's in the name, serotonin. That's what one of the S's stands for. And ADHD is a disease of the dopamine signaling pathway. But benzos, I mean, come on. Like
benzos?
Xanax? Who's prescribing benzos to kids? Like, I've never been like, oh, my kid's a little hyperactive. Better give him a few Xanax. Like, that's just not something that I don't think I don't think he knows what these drugs are or what they do, which is kind of scary considering he's in charge of the FDA. Everything.
This happened even in his confirmation hearing. He completely misrepresented the use of these drugs in the population, the pediatric population in general. He over exaggerated the number of kids who are on these prescriptions, and it's extremely low. I think in some studies it's like 5% or maybe less than that. And it's just so sad because, again, the imprecision is on purpose. The imprecision is because these very, very illicit sounding and emotional reaction inducing, word salads and quotes and moments in these hearings, they last a lifetime. It's the same kind of drama as what happened in the 90s with thimerosal. You get one person to say something. It doesn't matter that you have mountains and decades of data to debunk it. It sticks in somebody's mind. It's going to be memorable and repeatable, and that's all that matters. We've studied this in dynamics of information. If it's memorable and repeatable, it's very hard to put that genie back in the bottle.
Well, and this is the main technique. I mean, it's basically RFK Jr.'s entire career has been gaslighting America about vaccines and about public health and about the environment as well. And it's funny that you mentioned thimerosal, because today there was also quite a lot of discussion about mercury. And in particular, Kennedy was asked why, when, he's made a career out of fighting against environmental mercury and mercury pollution and air pollution and water pollution. Children's Health Defense, the anti-vax organization that Kennedy founded, originally started off as an anti-mercury organization that was against environmental mercury pollution, which is a real problem. And so Kennedy was asked actually several times today as well about the fact that Lee Zeldin, the EPA commissioner, is slow walking, deregulating a number of different chemical byproducts from industrial manufacturing that, the Trump administration has been like, chemical companies have a field day, forever chemicals for everybody, PFAS in everybody's water. And so they were supposed to lift these regulations, and Zeldin's been sitting on it because they don't want to do it right before the midterms, since most people don't actually want heavy metal poisoning in their water and air. So, they're not doing it. Kennedy has been fighting against this kind of thing his entire life. And I mean, my jaw almost hit the floor when this happened today. And actually, we have a clip for this too. Tara, could we play number 4, please? Thimerosal, by the way, is a preservative that contains mercury ions, but it does not contain elemental mercury. And it's a very common anti-vax trope that if you take it, which most people don't because it's not in most vaccines, then you'll end up with a bunch of mercury in you somehow. He actually also has now moved this to microplastics, because today he said the absolute jaw-dropping figure that our brains are now 1% microplastics.
That comes from that study that was debunked that everybody's got a spoonful of microplastics in their brain.
A teaspoon.
Yes.
Might be getting upgraded to a tablespoon if we don't stop these microplastics one of these days. But yeah, play the clip, please.
You're the Secretary of Health and Human Services. You made a career out of fighting mercury pollution. Are you telling me that you don't have an opinion about this mercury rule?
Well, I don't think any mercury is good, and that's one of the reasons we're holding up the Gavi grants, because they're giving mercury vaccines that are banned in Europe and the United States.
Mr. Secretary, I
161 million kids in Africa.
This mercury rule. This is your administration making this decision. Are you critical of it? Why have you stayed silent on this?
You should call Lee Zeldin here and ask him about those. That's not in my. I have a $2.3 trillion agency.
It's just so nuts. Like that he's saying, I wouldn't fund Gavi, which is the Global Alliance for Vaccines and Immunization. I can't remember what Gavi stands for. They're a vaccine organization that provides millions of vaccines to people in some of the poorest countries in the world. They've created vaccine access for millions of people who wouldn't otherwise have it. Gavi is an organization that you'd be hard pressed to find things about Gavi's mission to complain about. Like literally their mission is to save poor people's lives and children's lives.
Yep.
And so earlier Kennedy had gotten some shit for cutting grants to Gavi, which he should rightfully be criticized for, but also he totally doesn't care about. And this was his excuse. I don't care about environmental mercury anymore because that's Lee Zeldin's job, the EPA commissioner or EPA administrator. But, I care about thimerosal in vaccines that are going to people who would otherwise die of the diseases that those vaccines prevent, getting less mercury than in a tuna sandwich that doesn't accumulate or cause you any harm.
And so I'm gonna like geek out a little bit here because I get really, really hot about this topic. There is a big difference between ethyl mercury and methyl mercury. Methyl mercury is the kind of mercury that's derived from seafood, you can ingest it and it can accumulate. Ethyl mercury does not accumulate in your body. Ethyl mercury is the one that would be from thimerosal. Here's the catch. 96% of vaccines in the US don't have thimerosal. The 4% that remain, you know what they're from? Multi-dose vaccines, which we rarely use. And the reason why we use multi-dose is for things like congregate settings where you're needing like a mass amount. But this is where Gavi comes in. To not have multi-dose vaccines available would absolutely destroy the vaccine pipeline. It would make it so much more cost prohibitive to have individual vials per vaccine in places that are lower resourced, where cold chain is a problem, where supply capacity is a problem. So what he's doing, first of all, he's misunderstanding the basic organic chemistry of it all. These are not the same types of mercury. But what he's saying is he's trying to do harm reduction by not giving them mercury vaccines, when what he's really doing is preventing the vaccine access at all. Because the only way to have it be cost effective and mass produced for places in lower middle income countries is to have multi-dose vaccines, which require, because you're going to go into a vial I actually have a little vial right here. This is an old vaccine vial. You would go through this a couple times, and to prevent contamination, thimerosal is in it to prevent any type of bacterial growth from accumulating and causing infections from people getting another dose. This guy doesn't understand that. He doesn't understand supply chain. He doesn't understand basic organic chemistry. He doesn't understand anything about this whole process. And it drives me crazy because it's so easily debunked. And yet this is one of those things that remains. The basic misunderstanding of what mercury can and can't do in your body and its actual presence in American vaccines for kids is still lost on most people.
Yeah, and this, in many ways, it makes me so mad because it's such a condescending attitude.
Yeah.
Towards the people that are followers of what's now the Maha movement. I mean, it just assumes such a high level of stupidity and incompetence and a complete lack of critical thought. Because in order to swallow all this stuff, you really just can't, you don't ask any questions at all. Like nothing ever occurs to you that, wait, this doesn't really make sense. Like, how is this? I have some question. I mean,
right.
It doesn't occur to people. The reason, though, why it doesn't occur to people is not because people are stupid. It's because Kennedy for years, and I mean, today he really tried to remove himself from historically the lack of vaccination that is responsible for the measles outbreaks today, right? Because the measles outbreaks are spreading in school age children. His reasoning and his excuse today was that, oh, I've only been on the job for a year. That was the Biden administration. And boy, did we hear a lot about how the Biden administration is responsible for basically every bad thing that's ever happened. If there is a sad dog somewhere, it's because of the Biden administration. And if it's not just anybody in the Biden administration and not Joe Biden, then it's Javier Becerra, the former Health and Human Services Secretary, who was mentioned several times today for his, shall we say, I guess, too liberal immigration policies, or not really his policies, but what happened with immigration while he was HHS secretary, including children being separated from their families and all the terrible things that happen to children's health and people's health when they're put into ICE detention. Because guess what? That happened under the Biden administration too. So all the problems with Becerra and Biden are problems that have actually not gone away and have only gotten exponentially, to use one of Kennedy's favorite words, worse since Trump 2.0 happened.
Mm-hmm.
But Kennedy, just continues to say this stuff. And I mean, he continues to make things up and lie to people. As we've been discussing, he's gaslighting everybody. And the reason he's doing it is because he is counting on the fact that if he just says it enough people aren't going to question it, that nobody's going to question it anymore. And if somebody does, they're going to get shouted down by the mob that he's cultivating.
Yeah.
Now, there's some cracks in that. And I mean, I think that that's good. Today, I think that really did reveal it, because you saw all the GOP guys. I love your attitude, Bobby.
Yeah.
Like, oh, I also love your family. We all love your family. Both sides of the aisle were singing the praises of the Kennedy clan, that's for sure. But, and specifically his dad and his uncle. But, apart from that, most of the Republicans just got in line to tell him what a great job he's been doing. He's been finding all this fraud, you see. That's what they're saying, that all of the cuts to our government agencies are. It's getting rid of fraud. There's the Somali fraudsters in Minnesota. There's a bunch of fraudsters in California that are illegal immigrants. There's a bunch of people who are urban, who are stealing funds meant for rural people. There's all kinds of grifters and thieves out there trying to just take advantage of the common Maha working person. And you know what? They all seem to be related to public health or Democrats somehow. But that's what he got to hear from the Republicans. The Democrats, on the other hand, pretty much everybody went at him to some degree, some better than others. But
yeah,
they really weren't letting him up on anything. I mean, gender affirming care for kids, vaccines, any kind of health care, chronic disease. Several times today he said something that actually drives me completely insane, because it is directly contradictory to what I know as a scientist who studies viral pathogenesis and the role of the host in it. And that is that healthy people don't get sick from infectious diseases.
Mm-hmm.
This is something that Kennedy's been really implying for a long time, and the anti-vaxxers like to say it, because that's another one of their excuses for cutting the entire budget of the federal government. Our pandemic plan is not to go out and do dangerous research that's going to start pandemics with lab leaks. Our pandemic preparedness plan is just to drink some whole milk, raw milk, whatever, do the Pete and Bobby challenge workout or whatever, flip the food pyramid and get healthy. And if we just get healthy again, we won't get infectious diseases because they won't affect us because we're healthy. We've addressed the root cause, which several Congress people also name dropped today. Because all of these people, just like Casey Means, are into the same wellness, functional medicine, grifting kind of stuff. And the reason they want us to be all healthy is so that the vaccine manufacturers and the actual drug makers and the actual health professionals won't be giving you medicine. They will instead be selling you supplements and other crap that doesn't work.
Yep,
And
it's true.
that's the plan. It's a depressing day, and we've got 4 more of these hearings to go through. So buckle up, guys. We're going to have some wild clips for you, I suspect.
Yep, it is true. I mean, did you also catch the comments about the CDC and in the ACIP and how
Yes, and in fact, we could take a look at that really quick too.
Yeah.
I believe we do have time to run that clip. Tara, that's clip number 7, if you don't mind playing that one. I think that's a very important clip for everybody to take a look at.
Did President Trump approve your decision to end CDC's pro-vaccine public messaging campaign?
You've got a lot of misinformation there. First of all,
I'm asking you a question.
Let me respond to the misstatements that you've made.
No, you have other opportunities. I have limited time.
I only have
you're
the only opportunity I have to.
Did President Trump approve your decision to end CDC's pro-vaccine public messaging?
Allow me to respond to a lot of the misinformation.
No, answer my question, please, sir. I have limited time.
There's a global measles epidemic. We've done better in preventing it than any country in the world.
There is no country that has seen a bigger percentage increase.
That's not true. Mexico has 3 times our measles, and they have 1/8 of our population.
Approve your decision to end the CDC's pro-vaccine public messaging.
Canada has double the measles, and they have 1/8 of our population.
Did he approve that?
We've done better at preventing measles than any country in the world.
President Trump approve your decision to end the CDC's pro-vaccine public messaging campaign?
We've done better at preventing
That's
measles
not answering my question,
and ending the epidemic.
That is not answering my question. And I think you don't
want
to answer the question because I think you know.
I want to respond to your misinformation.
Terrible decisions that impact very, very real lives, especially the lives of children. Now, one thing that I find incredible is that you suspended this pro-vaccine messaging campaign, but somehow you're spending taxpayer dollars to drink milk shirtless in a hot tub with Kid Rock. And somehow you think that's a better public health message
Your time is
than
expired
informing
by a
the
minute.
public about the importance of vaccines?
Lady's
Really?
time is expired.
I mean, when she brought up the Kid Rock video, that's when I was like, I want to move to this lady's congressional district just so I can vote for her.
Yeah. Absolutely diabolical, that whole exchange. I was dying of secondhand embarrassment because of the fact that he just could not actually answer the question. It's amazing how he's able to dance around questions related to this. And I think it is partially what you referred to earlier, this short leash that he's on, where he is definitely muzzled in a way in what he can and can't say, which is why he's going to redirect the question to something else. We saw HHS post today a graphic that is extremely misleading about the incidence of measles as it compares to Mexico and other countries in the global outbreak. This is to deflect from the very real harms and hazards that they have created with their very, very confusing, inconsistent, and oftentimes directly contrarian vaccine views. They're just going to say, oh, but look at over here. But look at this other country and compare this outbreak to ours, wildly different populations. The same thing they did with Denmark, right? It's how they justified the complete overhauling of the vaccine schedule because they said, but what are they doing over there? And right. So we're sharing this to kind of show you, like, this is highly methodical message prep. They're working behind the scenes overtime to figure out how to dance around these questions. And it's only going to continue. I believe that there are more hearings happening next week. And so we can expect more of this dancing around questions. You know, what I was referring to earlier too was actually the one time I almost agreed with him was when the CDC was mentioned again in the context of the removal of the ACIP members, which he said was a necessary step for trust and transparency. I was like, you know what? Yes, that's the only thing I can agree on. Everything else he said was baseless and absolutely nonsense.
I mean, he just That's what he does, actually. By training, he is an environmental lawyer. He is essentially a civil rights lawyer and an environmental litigator. But really, what he is a propagandist. And that's what Children's Health Defense is. I defy anybody who considers themselves a good or a moral person to watch the video of Polly Tommy and Brian Hooker from Children's Health Defense interviewing the parents of that first girl that died from measles and getting those people who had just lost their child, who were grieving the loss of their child, who are not well educated people and probably don't have a very good understanding of infectious diseases or vaccination, convincing these people to say on camera that they were glad that their child died of measles because it was God's will. They would not vaccinate any of their other children because the measles vaccine is dangerous. And this is after it literally killed their child. Now, I don't think that they are bad people. I think that they were grieving parents who found themselves preyed upon, essentially, by grifters who don't care how many children get hurt or how many children die because they are making a ton of money off of it. Brian Hooker, one of the people who was interviewing that family, then bragged that he got measles despite having had a single dose of the MMR decades before when he was a kid. He got measles and he intentionally and without telling anybody flew to California. Now, I don't think he actually had measles, but he thought he did. And just the idea that you would be the kind of person who would intentionally get on a plane when you're infected with what you know is one of the world's most contagious viruses, putting all kinds of people at risk for death, which you were literally just making propaganda about. What kind of a person does that? What kind of a person thinks that it's okay for children to die so that they can be right or that they can make money by lying to people about their health and about their children's health? To me, I mean, I don't think you have to be a religious person. I don't think you have to be a particularly like goody two shoes kind of a person. I think I'm actually generally kind of an asshole, but I find it completely morally reprehensible that anybody would ever think that their opinion or their preferred policy option or whatever somehow supersedes a child's life, especially when your job is to be the chief safeguard of children's health and their lives in the United States.
Honestly, Angie, I am at the edge of my seat thinking about what's going to happen next week. He's going to be testifying in front of the HELP committee that you and I have been screaming on the internet for the past, I feel like 6 months now. The HELP committee is the one that Senator Bill Cassidy is the chair of. The HELP committee is the one that is now considering Casey Means as Surgeon General, still considering Casey Means as Surgeon General. The HELP Committee is why we have RFK Jr. in the first place. And that is happening on April 22nd. And so this is an invitation to join us then, because that one I think is going to be even more fill in the blank with whatever superlative adjective that you have to describe how today went. I think it's probably going to be very, very hostile because right now, the decisions that are coming out of the HELP committee have already shown measurable harm, and they're probably going to show more if we don't stop Casey Means from being advanced as the Surgeon General. The one, I feel like if we're going to land on some good news today, it seems like the new nomination for the CDC director is a step in the right direction, as apparently the MAHA team really dislikes her, which is somehow a good sign for us.
Yeah, one thing I've noticed, Jess, is that since RFK has been, leashed prior to the midterms, I don't think it's going to work. I think Trump's problems are a lot bigger than just crazy old Bobby Brainworm, but we'll see, I guess. But anyways, I mean, Casey Means came up today too in this hearing, and it was basically just brought up that Casey Means, like the HELP committee, is not is not courageous enough, essentially, to advance the hearing, as we've been discussing for the last month. I think is when we decided that was probably the reason why the vote wasn't moving forward. And it seems that that's the case, and it seems that some of the other Democrats in Congress, at least, are recognizing this as well, and are saying essentially that with Casey Means, like, she is the example of what we don't need. What we do need is somebody who's competent, and that the leadership issue was brought up multiple times. Erica Schwartz, the nominee for the CDC director, I almost can't believe my eyes, because I was looking into her the last day or two to try to find out why they like her. In other words, why I won't like her. And I was unable to find anything. I mean, from what I can tell, she stepped down from her prior position as Deputy Surgeon General in the first Trump administration because the Biden administration told her that they weren't going to make her acting CDC director, or sorry, acting Surgeon General, which it would be sort of weird if you stayed in the job, if that were, if you were told, like, we're going to hire somebody else to do this job that you want, but like, you could stick around until we fire you.
Yeah.
I mean, it was basically why she left. So I don't see anything wrong with her. And it seems that the Maha people not only don't like her, they really actively hate her. Aaron Siri seems to think, and he's one of Kennedy's ambulance chasing lawyer friends. He thinks that, we need to, all vaccines are terrible, so he should sue all the vaccine manufacturers and make a shitload of money for himself. He hates her. So if Aaron Siri hates her, then she must be doing something right. So so far, Erica Schwartz has, retired Rear Admiral of the Public Health Service Commission Corps, has my endorsement for now.
Yeah, agree.
But yeah, go ahead, Jess.
No, go ahead.
I was just going to start walking us out since we're at the top of the hour. It's Thursday night, and if you've been watching Kennedy all day like we have, you probably need to go out and grab yourself a cocktail or do something relaxing that will set you on the right track for the rest of the evening. That's what we're going to go do, but we're going to be back tomorrow at 2 p.m. Pacific, 5 p.m. Eastern time at our Substacks, Jess's Instagram, my Twitter, health site, X. And we're going to be still covering this because there's a lot that we didn't get a chance to get to. And unfortunately, I'm still not very good technically, so I wasn't able to cut a lot of clips of Bobby acting crazy on the fly. But tomorrow I promise to have a better collection of that, and I'm going to practice over the weekend so that next week I'm, little whiz with him saying all kinds of crazy stuff with a tomato red face.
Yeah. Can't wait.
Excellent. Well, one more piece of housekeeping news. For all of those of you who are rabid readers of our newsletter, the Maha Morbidity and Mortality Weekly Report, you must be checking your inbox every minute, waiting for the new edition to come in. And I apologize. Both of us have had a really busy week. We've been working a lot. And so we've got the draft almost done. It's going to be published tonight before we go to bed, and we'll chit-chat about it tomorrow. Promise to be better about that schedule. It's just hard when, you're both working moms of humans in Jessica's case and dogs in mine.
Yeah. Well, we'll see you all tomorrow, and stay tuned for more long-form updates from us.
Yes. Thank you so much for joining us. And one last thing, you will notice that this is sponsored by the Save America movement. The SAM team is doing all kinds of great work, and that's why I'm on the steering committee, and that's why we do work with them. They are fans and champions of science and democracy, and a lot of really great people. So do consider joining the Save America movement, or at least coming, following, subscribing. You can follow both of us and subscribe to both of us as well to find out some more. Reach out to us if you have any questions. Take care of yourself. Make sure you get vaccinated.
Yes. All right. Bye, Angie.
Take care, everybody. Bye, Jess.